Today's subject is when you go to hospital, unexpected diagnosis comes. I am taking care of my mother, who is 97 years old right now, and then she has some kind of a boil in the hip like this. And this picture is before, you know, after I treated some, and around here, and there was it's red and inflamed, and I asked my mother that I am going to put some needle in there. So after put some needle, that a swollen area is shrink. However, that the spot over there, and it's the red, and there's a scab in there, and wounds come out in the center. So I put a thick gauze in there, but whatever I do, it's nothing much effective, or to help her. And I want to treat that, but I have to ask my mother, and I asked my mother that can I put some needle, try to help, and yeah, she could not move at all whatsoever, and it's very difficult to move the arm, move the hand, to get in the right spot. But unfortunately, my treatment for that is a fail. And when I look at that, only way is that I have to use a suction cup. So I told my mother that Mom, this one is only I can use a suction cup, and she understands suction cup, but she told me I'm going to die in 2-3 days later. Then I don't want that pain. No, I don't want to. So I give her some kind of pain medicine, like aspirin, but it doesn't work at all. Then 1 o'clock in the morning, I heard that my mom crying. So I went over there, and then she has some pain. So I tried to move to another side. Take a 10 to 20 minutes. Then 2 o'clock in the morning, she cry again. Then wait a second, there's no way I can do. And then then 3 o'clock in the morning, she cry again. I could not sleep at home. And so suddenly, I have some idea. So I asked my mother, Mom, do you want to go to emergency rooms? And she said, okay. So I called 911, and then emergency ambulance came. So I brought her emergency room. And in emergency room, that there are many procedures. So I finished it all, and wait my medical doctor to come out. And so then finally medical doctor came out. So I told the medical doctor that she had pain on the right side hip, and she's okay. And then I came home because I am not allowed to go to emergency room these days. So 9 o'clock in the morning, I got a phone call. They found out urinary infection. Okay, you found urinary infection, and then the primary reason for her is pain on the hip. And second one is, as you found, that you can treat urinary tract infection. But she does not mention at all whatsoever about pain on the hip. So I don't know their system much, and then even though what I said, I am not allowed in the emergency room, and then they're gonna do whatever they want to. So I just shut the mouth. However, that my feelings very dubious. Oh, something. What's going on here? Now, then suddenly I think something that my patient got the same experience like this, and one of my patient have low back pain. So she went to medical doctor after all examination, and then doctor told her, "Oh, you have cervical cancer," and then cancer treatment. But her low back pain was still there. Then another person went to doctor, and each eyes. So they went went inside, went doctor, and the conclusion is because of uterine fibroid. I don't understand what's the relationship with each eye uterine fibroid. So there is some kind of old saying that a blind man touch elephant leg, and this is a pillar, and this is touch the nose. This is something. What's the difference? If there is no obvious conclusion, but they just do whatever they want to. There's no connection. This is reality. Thank you so much for your watching.